Good morning. Today's class is a special topic on diabetes. What we know is that there is a strong connection between individuals with heart disease and those with diabetes. And similar to the idea of the chicken versus the egg debate, sometimes it can be hard to know which one came first, or even when it comes to managing the disease, which one takes priority. So for that reason, we throw this class into our mix of cardiac rehab education series. What's important to understand and remember is that diabetes, though often misinterpreted or misdefined, is essentially a condition in which the body does not properly use food as energy. And as a result, there's a buildup of certain nutrients in the bloodstream. Most specifically, that buildup is sugar or glucose. It's a very widespread disease. Estimated that by 2050, 1 in 3 Americans will be diagnosed with it. And what we also know is that when left uncontrolled, diabetes can lead to serious health complications, including but not limited to heart disease, blindness, kidney failure, and even the loss of limbs. And it is for these uncontrolled side effects that diabetes lands in the top 10 leading causes of death in the United States. But again, note that that means uncontrolled diabetes. When our blood sugars and our diabetes is better managed and better controlled, we can prevent, delay, or avoid all of those serious health complications. There's a lot of different types of diabetes, though the most common, especially in our population, tends to be type 2, a condition that the body does not use insulin properly, though it does still make some insulin. Sometimes individuals who have type 2 diabetes will still require insulin shots to help increase their insulin levels, but it's not always the requirement. Type 1 diabetics, on the other hand, don't make their own insulin, so they do require insulin injections. It's a little bit less common. Only about 5% of diabetics are diagnosed as type 1. But what we see is this growing and what's relatively known as a borderline diagnosis called prediabetes. This is a relatively new term coined by the American Diabetes Association, and essentially, it's a condition that we can prevent from turning into diabetes in the future. I've already used this term a couple of times, insulin. Insulin is important to understand when we're talking about diabetes. It's a hormone produced by our pancreas, and essentially, it acts as a key to unlock the cell and receive nutrients from the blood. When we eat, our food is digested and broken down into various particles that go into our bloodstream. One of those particles is sugar or glucose. Again, the whole role of insulin is to allow that glucose to go from the blood into the cell where it can be used as energy. It really doesn't do us any good to have sugar or glucose just hanging out in the blood. It needs to actually move into the cell. But I'm sure all of you have been in an instance where you've been locked out before. It's essentially what's happening when insulin isn't working well, when diabetes is a factor. That key isn't clicking, the door isn't opening, and there's a buildup on one side without the nutrition moving into the cell. So if we were to check somebody's blood sugar readings, what we'd find is that an untreated diabetic would have much higher blood sugar levels, that represented by the green line here, than somebody whose blood sugars are normal and who isn't a diabetic, represented by the line in blue. And then you'll notice that one in the middle, the red line, would be representative of our pre-diabetic population, somebody who's on the border of a possible diabetes diagnosis. What I want you to see on this graph is that we've got 3 totally different hills here. And if we liken them to roller coasters, for those of you that like thrill rides, I'm sure you'd much rather ride on the green track than you would anything else. But the funny thing with our body, it kind of hates thrill rides. The idea of up and down and back again does our body no good. Our body likes things to be predictable, relatively boring, so to speak. And so that blue line is our body's preference. When we start to experience those highs and lows like a roller coaster ride, other body systems can get involved and it can lead to some long-term damages. I've got 5 different systems represented here on this page that show some of the potential complications associated with long-term elevated blood sugars. But for all purposes of today's discussion, I want to focus on the one that's most notable, and that's the relationship of diabetes and our heart health. Diabetics are at twice the risk for a heart attack or stroke because what happens is they generally have narrower arteries or blood vessels. Thus, the risk for getting those arteries clogged is higher in our diabetic population. Managing our blood sugars and keeping them under control can significantly reduce the risk that narrowing is going to negatively impact our heart health in the future. Now, you can't feel your arteries getting smaller, and oftentimes if you don't know what you're looking for, you don't know if your blood sugar is dropping low or climbing high. However, here's a few different warning signs or symptoms where your body may be telling you it's time for some attention. Now, a lot of times these signs and symptoms get written off as part of the aging process. Well, you're just more tired than usual or irritable. You need your glasses changed because your vision seems to be a bit more blurry. Getting up often to use the bathroom. Yes, these could all be signs of the aging process, but it also may be something else going on behind the scenes where your body's trying to tell you, you know what, I think I need a little bit of attention. If you're experiencing any of these signs or symptoms, it may be worth a conversation with your doctor to see if a simple blood test could rule in or out a possible diagnosis. The most common way, or what's becoming more and more the gold standard for diagnosis, is the hemoglobin A1C test. Less than 5.7% when you're considered out of risk, normal, non-diabetic. But a range of 5.7 to 6.4 would indicate pre-diabetes. That yellow flashing light, your body telling you, you know what, take action, I need a little bit of attention, something's going on behind the scenes here. And then once you hit 6.5%, you're diagnosed as a diabetic. And here's the thing, once you're diagnosed as a diabetic, even if you get your blood sugars back under control and you get back down in that percentage range, you'll always carry that diagnosis with you. The two other tests on this slide, the fasting plasma glucose test and the oral glucose test, are other ways to measure or diagnose diabetes. The glucose lab oftentimes appears on a standard blood draw, one that you might get done annually, known as a CBC. If you were fasting, then these numbers could apply so that you would see the normal, pre-diabetic, and diabetic diagnosis ranges that I have listed here on the slide. The last test, the oral glucose tolerance test, it's rather lengthy. It's typically more of an old-fashioned way, I would say, to diagnose diabetes, since we do have two other methods to do so. It's not that it's a wrong test, but it isn't used as often, so we're not going to spend time talking about it today. If you have a family history of diabetes, or if you're noticing those signs or symptoms of diabetes, again, it may be worth a conversation with your physician to see if a lab test would be warranted to rule in or out a possible diagnosis. With this terminology out of the way, let's talk today about how to better manage diabetes. And interestingly enough, a lot of the management techniques that we're going to talk about today are also very applicable to preventing diabetes as well. So even if you don't currently have the disease, a lot of the strategies we're going to talk about may help keep it that way. The 5 bullet points I have listed here are essentially our 5 key steps to take to manage diabetes the best way possible. Our food choices, what, how much, and when we eat truly do impact our blood sugars and can help with our diabetes management. How active we are can certainly help improve insulin sensitivity and as a result, improve blood sugar levels. And if we're overweight or obese, weight loss, about 10 to 15 pounds, but really in the ballpark of 5 to 10%, can significantly lower hemoglobin A1C readings. If you're prescribed diabetic medications, just like any medication, it is important to take them as prescribed, both by milligram amount as well as time of day. And if you're supposed to be taking insulin, understanding, do I take that insulin before meals or after? And then finally, blood sugar checks. The word regularly means something different to everyone. However, I'll give you my definition towards the end of today's presentation. Let's start instead with the food. Now, I don't know if many of you have heard anything about carbohydrates in today's more popular diets, but a lot of times I feel like carbs get a pretty bad reputation. If you've ever heard of the ketogenic diet, paleo or Atkins, South Beach, a lot of these more popular ways of dieting or weight loss involve relatively low carb ways of eating. And while it certainly may result in weight loss, the difficult part with them is that they tend to be a challenge to maintain long term. The big reason behind that, if we actually start with the third bullet point on this screen, is because the food groups that contain carbs, well, they're pretty widespread. If you take a look at this, bread, cereals, rice, pasta, some vegetables. For diabetics, we count these like a carbohydrate. We no longer call them a veggie. Those would be our potatoes, corn, dried beans like black beans, pinto beans, garbanzo beans. So basically all beans but green beans. And then lastly, peas. Fruits and juices, milk and yogurt, most of our sweets and sweetened beverages, as well as most of our snack type foods. These are all foods that are relatively high in carbohydrates, and again, the thought of eliminating them or getting rid of them for long term can be nearly impossible, which is why oftentimes those low carb diets don't last very long. The other component with that is our body, our brain, in fact, prefers carbohydrates as its energy source. We need carbohydrates. In fact, we need them in the highest percentage of other types of foods in our diet. But what we also want to remember is that they do have a direct impact on our blood sugar. Eating carbohydrates will require some better blood sugar monitoring and some balance when it comes to our food choices. And we'll talk about how to achieve that here in a minute. What I want to note is that within the class of carbohydrates, there is a group, more of our added type sugars, and these are the food groups that if we're really going to pick on, eliminate, or reduce something, this is where I'd want our focus to begin. Added sugar, just like its name implies, is the sugar added to processed foods. Relatively empty calories, and we'd find them in things like candy, sweetened drinks, most of our desserts, etc. If you think about an apple is naturally sweet, but the farmer who grows the apple doesn't sugar the soil or sugar the apples in the orchard or sugar them when they get to the store, but the apple does have sugar existing in it. If you were to take that apple and turn it into an apple fritter or an apple pie, well, now we've got some added sugars at play. Tea. If you were to pick a tea leaf, it wouldn't taste naturally sweet. But if you take that tea and you sweeten it with sugar or honey or some other type of nectar or syrup, now you've added sugar to a food that wouldn't normally have it. That's an added sugar, and that's what we're trying to limit. So the recommendation from American Heart Association is no more than 24 grams of added sugars daily for women and 36 grams daily of added sugars for men. Remember, that's not total sugar, that's added. But the limit is in place to remind us that because these sugars don't necessarily provide balanced calories, what they really do is send us on this roller coaster ride of blood sugars, represented here in the blue. They're the types of carbohydrates we really want to be mindful of. And going back to what I said earlier, how do we balance out our carbs regardless of where they're coming from? It requires the idea of balance. And you've probably heard me talk about balance in a variety of our cardiac rehab classes. But when I'm referring to balance today, what it means is that we eat those carbohydrate foods and we balance them out with foods that contain protein or our non-starchy vegetables to help create better blood sugar control. Foods that are rich in protein but still mindful of heart health would include lean meats, round or loin cuts of our beef and pork, poultry without the skin, fish, ground meat that's 90% lean or leaner, eggs, and remember for heart health we generally mean no more than an egg a day, but egg whites in any amount or egg substitutes are fine. Cottage cheese and regular cheese, Again, with heart health in mind, I would recommend a lower sodium cottage cheese and being mindful to choose a part skim, regular cheese if possible. And then nuts and nut butters. Including protein-rich foods at meals and snacks when we eat our carbohydrates can help establish a better balance without us feeling like we need to limit or eliminate that food group altogether. The other thing to consider would be adding in those non-starchy vegetables. All those veggies other than corn, potatoes, peas, and beans, because as we mentioned earlier, those 4 are considered carbohydrates for our diabetics. So let's look at it differently, and let's take a look visually. At mealtime, essentially what we're trying to do is create a balance that would involve the bottom of that plate, that pile of white stuff is rice, above it is, I don't know, chicken or salmon, and then the right half of the plate is the broccoli. We've got our carbohydrate from the rice, protein from the meat or the fish, and about a half a plate of non-starchy vegetables. Now, as blood sugars allow, you're welcome to add additional servings of carbohydrates to this meal, but being mindful that if we can better balance our plates at a meal from the very beginning, we're probably going to have better balance all across the board when it comes to nutrition, blood sugars, and diabetes management. This plate works well as an example for lunch or dinner, but I don't know how many people eat a half a plate of vegetables at breakfast, myself included, and so for that reason, breakfast is modified just a little bit. For breakfast, we recommend that while you do choose a carbohydrate source, you also include a food that has protein as part of it to balance out the impact on your blood sugars. A lot of our common breakfast foods are rich in carbohydrates. Cereals, whether they're hot or cold cereals, pastries, granola bars. A lot of these items, breads, English muffins, bagels, they fit the bill when it comes to typical breakfast foods, but they tend to be higher carb. So balance out those options. Say, you know what, instead of just a large bowl of cereal, I'll have a smaller bowl and a hard-boiled egg. Now I've got some protein to balance out the carbs. That maybe instead of just a bowl of oatmeal with brown sugar, have a smaller bowl, but I throw in a handful of walnuts, the nuts providing that protein. That instead of just toast with butter or toast with jelly, it's toast with a little bit of a smear of peanut butter. Or it's an English muffin with peanut butter. To be mindful that when I can include some protein at breakfast, I can better start the day with blood sugar control. There's another way to help us manage the amount that we eat and our carbohydrate content, and that does involve a little bit more math through carbohydrate counting. For every 15 grams of carbohydrates you see on a food label, we would count that as about 1 serving of carbs. You'll also see it written as 1 carb choice. Most diabetics are recommended to have 3 to 5 choices or servings of carbs per meal, which translates to about 45 to 75 grams of carbohydrates at mealtime. But remember, it's not just saying no to extra carbs, it's also making sure that we're saying yes to the protein and yes to the non-starchy vegetables, so that 3 to 5 servings, or 45 to 75 grams, doesn't feel overly limiting or restrictive. If carbohydrate counting is something you want to learn more about, that's something I'd love to help you with individually, but this certainly takes into consideration any insulin use you may be having or certain or specific blood sugars that you're getting. When we eat can matter just as much as what. So when it comes to meal timing, my biggest recommendation is try to eat around the same time each day, starting with a breakfast within about 2 hours of waking up. After that, meals should happen in a perfect world every 4 to 5 hours or so. And if you're going to go much longer than that, I'd recommend bringing a snack in case you experience a low blood sugar. Even if you're not feeling the low, if a blood sugar check indicates your sugars are dropping low, you have a snack handy to help correct that. Remember, it's important to consider those every 4 to 5 hours of meals or balanced snacks throughout the day. Try not to do that through the middle of the night. Midnight snacking generally can wreak havoc on our blood sugars and make it difficult to manage them during the day. Now, food obviously plays a role. We wouldn't have spent this much time on it if it didn't. But another very important factor for diabetes management is our activity. What we see is that with regular exercise, our cells have an improved sensitivity to insulin, any insulin we may be making or any insulin we're injecting. We're better able to manage our weight when we're active. We have a lower risk of heart disease when our activity fits within the 150 minutes per week recommended by both American Heart Association and American Diabetes Association. If you come to cardiac rehab 3 days each week, 90 of your 150 minutes of cardiovascular activity, put a big old check mark by it. If you're coming 2 days a week to pulmonary rehab, well then 60 minutes of your recommended amount, put a big old check mark by that. Already, you're doing great things for your diabetes and your heart health by including in that physical activity. The one thing I will say though is that because exercise can lower our blood sugar values, it's important to check your sugars both before and after activity to see how your body is responding individually. Make sure you have a snack on hand so that if you do drop low, you'll have a way to correct it relatively quickly. And I don't generally recommend exercising unless your blood sugars are between 1 and 300. So speaking of those blood sugars, A, what should they be? And B, when should I check them? Well, generally speaking, these numbers here from the American Diabetes Association give us a good guide as to what to look for or follow when it comes to fasting or before meal checks, bedtime checks, or 2 hours after a meal, sometimes also referred to as postprandial blood sugar checks. These ranges are certainly not meant to trump any recommendations given to you by your physician, but to serve as a guide to say where should I be, and if I'm vastly out of this range, what do I need to do to help correct these values? If you're only instructed to check your blood sugars once or twice a day, what I would recommend doing is alternating the times of day at which you check them. For example, if you only ever check your blood sugar first thing in the morning, you'll only ever see what your sugars run right when you wake up. You may want to consider checking them fasting in the morning on Monday, maybe before lunch on Tuesday, bedtime on Wednesday, and then 2 hours after dinner on Thursday. Well, now we've got a much wider range of how our blood sugars are acting during the day, and we're better able to correct or manage them should any of these numbers be out of the suggested ranges. So for those of you watching who do not currently have diabetes, let's keep it there. And how do we do that? Well, here's your quick summary. That through a healthy, balanced diet, regular physical activity, we're probably more likely to maintain or achieve a healthy weight and thus reduce our risk. You may have seen models called MyPlate in various other classes or even at doctor office visits. That MyPlate model is a fantastic guide for how to eat. But if you find that while preventing diabetes may be one of your goals, you also want to include an eating style that mimics the diabetic pattern, use the plate we talked about in earlier slides in today's presentation, the one that suggests carbohydrate, protein, and a half a plate of those non-starchy vegetables. It's a great way to initiate balance that hopefully will continue to allow prevention of this disease well into the future. It's a very specific condition, so if there are questions I can help you with or individual attention that you need, by all means feel free to reach out and contact me. Call the number for cardiac rehab and ask to speak to the dietitian so we can set up an appointment and discuss how we can best manage diabetes together. Thanks for your time and have a great rest of the day.